This was launched last week in Geneva, and it refers to the importance of overcoming the current disruption in the financing of the AIDS response. I have three top messages for you this afternoon. The first one is that the HIV epidemic is not over and our previous progress is at risk. My second message has to do with recent declines impacting HIV prevention and community services in particular. And this is important because the resources, the response on prevention has kind of flatlined. We were looking at an increased take up on treatment, and that has also been reduced. And that is impacting, again, the prevention programs for young people and key populations. Most of the community response has depended on foreign assistance, and that has currently been impacted. Some national AIDS commissions in African countries have had to invite or provide office space to organizations that have been left without that kind of funding. And UNAIDS anticipates that with the impact of these fundings will represent 1.4 million annual new infections by 2030. So that will take us back 3.9 million people newly acquiring HIV by 2030, in excess of what we would have hoped to be the end of AIDS as a public health. The funding sources that still remain and the countries filling in the gaps be enough? Not necessarily. Other actions will be important. And in this case, prioritization will be essential. And that does not come in a cookie-cutter approach. Each country will need to decide on what their priorities are going to be. Evidently, we point to prevention because we need to reduce the number of new infections in order to address, the growing epidemic. Regional leadership is going to be important. African Union Roadmap to 2030 and beyond has pledged to ensure diversified and sustainable financing for HIV and other health programs. So that regional approach is going to be essential. The new Global AIDS strategy that is supposed to be adopted in the next few days at the UNAIDS board in Brasilia will provide, the strategy necessary for countries to focus the epidemic response that they need to address. And evidently, if countries scale up their HIV services to reach the 2030 HIV targets, then 3.3 additional new HIV infections could be averted compared to maintaining HIV treatment prevention services.